Hello everyone, it's the Fly Foot Doctor. So I wanted to make this video really quickly just to kind of give you guys a few tips and explain a little bit about growing pains, specifically heel pain in kids and what that all means. So what usually would cause heel pain in a kid? Now, one of the most common causes of heel pain in kids is what we call calcaneal apophysitis or Sever's disease. Now, what this really means is that there is just inflammation in the growth plate. It's not an actual disease, but it was named Sever's disease, but in general it's called a calcaneal apophysitis. And that what happens is there is inflammation in the growth plate. Now, a lot of the times, one of the most common times or age group that you will see this is kids that range from sometimes as young as 6 years old and sometimes as old as 15 years old. And that's because this growth plate that does exist within the heel bone does not close till about 14 or 15 years old, depending on the development of your child. And so when that growth plate is still open, they may have inflammation in this area. This is what we call the calcaneus. So this is the heel bone, and this right here is what we call the apophysis or the growth plate. So when we say a calcaneal apophysitis, it's inflammation of this growth plate right here. This growth plate is lined with cartilage, and sometimes when kids get active and are running a lot and jumping or into sports, this will be inflamed and cause pain and discomfort. The growth plate is where the bone gets bigger, and this is where the bone increases in size depending on what Mother Nature has determined the heel size to be. So again, when it's inflamed, this is the area that will be inflamed. So patients or kids will complain of pain right here on the back of their heel or at the bottom of their heel. One of the common reasons where this inflammation starts is because they become active. A lot of the times a patient will come and say, well, my child just started this sport or that sport, and then after a few weeks they started complaining of heel pain. And some people will call it, oh, it's just growing pains, which it's sort of right in a way. It's because you're growing, but now the idea is you're putting much more strain through that growth plate. And so that strain and that stress is now causing pain and inflammation. And so that's when the mom or the dad or the caretaker brings the child to the doctor. Now, if that happens, what are some of the things or the symptoms that you may see in your child or in your niece or your nephew or a younger person that might make you start to think of calcaneal apophysitis? Well, some of the symptoms include difficulty walking, limping, walking on their toes, difficulty running, sometimes just pain and discomfort when just walking, and general tiredness. So when you take your child to the doctor's office, they're going to take an x-ray, do some physical examination, have and obtain an adequate history, and they'll be able to give you an idea of what exactly is going on. Now, some of the things that you could do at home before you take your child to the doctor is perhaps restrict your child from the activity, hold them back a little bit and see if it gets better. Sometimes some over-the-counter medication will definitely help. Having the child wear supportive shoes or even a fracture boot that you can get online may be able to help to just kind of offload that heel and let it rest or get better. So all of this is a quick synopsis of heel pain, especially in kids, specifically calcaneal apophysitis. If you have any question whatsoever, leave them down below. If you have any comments, leave them down below as well. It's the Fly Foot Doctor. If I have given you any form of information, or if you've enjoyed this segment, would you consider subscribing? Also hit the notification bell so that when I post, you'll be sure to get it. And please share this video with your friends and family. You never know who this may greatly benefit. Thank you once again. Until next time, it's the Fly Foot Doctor. Be sure to follow me on all my other social media platforms, including Instagram, which is again the Fly Foot Doctor, or on TikTok, the Fly Foot Doctor. For my business page, and if you want to book a consultation with me, you can follow us at dneilfootandanklecenter.com. That's our website, and we're also on Instagram and on Facebook. Till next time, bye.